Welcome back. The Steve Marston Show continues. So great to be with you here. And it's time to welcome in a special guest. And this is going to be a fun conversation, although it's going to be a hard conversation. You know, we try to keep things as lighthearted and as fun as we can, but there are some things that are serious and there are some things that need our attention. And one of them is this, I mean, all you can call it is something straight from hell, is that abortion medicine that is available to ladies all across the country. This is such a terrible thing, and we'll get into it as to why. But these ladies that are in crisis pregnancies are taking this, and it's become their worst nightmare, much more than the pregnancy being a crisis. And we're proud to welcome in Susan Liebel. She is the Director of State Affairs for the Susan B. Anthony Pro-Life America. Sue, welcome in. Thank you for joining us here on the Steve Marston Show to talk about this kind of scourge that's on our country.
Hi, thanks for having me. Yeah, it's not a very comfortable discussion, but it is so important because it's becoming a real public health threat now. You know, when the Roe versus Wade was overturned a few years ago, a lot of states did, restrict abortion to a great degree. But because the FDA still allows them to be mailed, they just are going right over the borders into the states not legal. And so much for state sovereignty, for one thing. Yeah.
Exactly. And this radio show is heard in two states, Arkansas and in Texas. And both of those states had this trigger law. If Roe versus Wade were ever overturned, that it would automatically become illegal in our states. And it has been. But the thing that makes this so bad, obviously it's an abortion drug, so that's horrible enough in and of itself. But this is not regulated by the FDA or really anybody, is it? I mean, to just think that this can be available as quote unquote health care, it's mind blowing.
You know, there's a couple things. One is abortion is never health care, because abortion is a procedure, and it's almost always, not always, but on a healthy mom, a healthy baby. So it's really a procedure. Nobody's getting, but the FDA approved this drug in the year 2000. When it did, it put a black box label, this is a dangerous drug, and had extra steps for doctors to have to go through before they prescribed it, ruling out pre-existing conditions and certain things like that. Under President Biden during COVID was the excuse to not have her see a doctor. Remember when we couldn't go in anywhere? So under Biden, the FDA relaxed that, the idea that you have to see a doctor. And so they just allowed it to be mailed with no medical input. And for some reason, Trump FDA still won't rescind that rule. So it can still be mailed with no medical oversight. So you might be thinking telemedicine, like, I don't know about you, but I've had a telemedicine visit with my doctor before. That's not what we're talking about. We're talking about rogue websites, and women are desperate. And it's becoming, states are starting to fight with each other now. The state of Texas suing a doctor in New York for mailing those pills in. And New York says, we won't extradite her. We'll shield her from prosecution. You can't get to her.